this book is a resource, not just for maybe people who are athletes or people who used to be athletes in high school but don't work out anymore because of X, Y, or Z, but it's also potentially for people in your field who need to maybe look at these things in a different light. Share more a little bit about, the different audience of people who are going to read this great this great work, but also like what you hope that they can receive from it.
Yeah, it's a great question. I think there's the main message in here is turning all the rejection and feeling like we're frail, fragile, and broken, all the nope into hope. And
Yeah.
once we have hope, the healing system is going to kick off. I work with this one client who is just beautiful lake house.
Mm.
And during spring, summer, and fall, I'd be working with them, and there'd be a cardinal that came to the window and would just start pecking at the window. So I would always kind of laugh at it, but just having a curious brain, I was like, huh, why does a cardinal keep doing that? Learned from my client that the cardinal sees its reflection and is actually fighting against itself.
Wow.
So now I see that cardinal come, and instead of laughing, my thought is, dang, we're doing the same thing.
Yeah.
We're doing the same thing over and over and over again. And to back that, I'll give some examples here. The MLB with the shoulders rotator cuffs, they do the most violent motion in sports with throwing a baseball. 89 to 91% of them have a torn rotator cuff and have no symptoms whatsoever.
Wow.
92% have a torn labrum and have no symptoms whatsoever.
Wow.
They're still pitching, they're still playing, they're going about their day. What we found from the research and in the science is that people used to have pain, they'd go into the provider would do an image, and then on the image they would say, this is why your pain is happening because of what's happening on this image right here.
Mm.
Researchers got clever and they said, what if we started imaging people that don't have symptoms? Like, let's just take a picture of people that aren't in pain.
Mm-hmm.
And they started doing that, and it was really a shift that happened of, wow, more of the population has a disc herniation with no symptoms than the population that has a disc herniation with symptoms.
Wow.
More people have torn rotator cuffs with no symptoms than people that have torn rotator cuffs with symptoms.
Mm-hmm.
And again, like, you get one article of this and it's like, oh wow. But when it's repeated over and over again, it
Sure.
starts to really get to you
Of
and
course.
start to wonder, why the heck are we doing images before we ever even talk to people and get the full story? Why aren't we asking questions of, how's your work life? How's your personal life? How is sleep going? What's your nutrition like? All these factors that make you human. What's your environment like? Instead, we're just taking a picture, and now that picture is coming from a respected figure, and because the respected figure is saying that there's something wrong with you, your brain now has to believe that something's wrong with you. But deep down, you know it's not there. You know,
Wow.
if I've had degenerative joint disease for 30 years, why all of a sudden does it hurt now?
Right.
Why didn't it progressively get worse over time? Why does it hurt now in this moment? Oh, it's the same time that your kids are leaving for college and you have to reconnect with your wife.
Mm.
Potentially you're going through a divorce and those symptoms come on. But we're really learning that pain is a complicated experience, but it's really a threat to the perception that we're going to lose meaningful activity.
Mm.
And if I'm told that there's something wrong in my body, so because of X, I can't do Y, now I'm afraid I'm going to lose meaningful activity. And what is that meaningful activity? It could be picking up a basketball, playing with your kids. It could be throwing a football with your grandchildren. It could be you work in a warehouse and your sport is that you lift boxes for 12 hours a day. Someone told you you have a bad back. Now you're wondering, how am I going to provide for my family?
Mm.
This is what I do to put food on the table. So whether it's provider, whether it's an athlete, whether it was an ex-athlete, once you're an athlete, you're always an athlete. There's no such thing as an ex-athlete,
Sure.
but it's more important that you're living out the values of an athlete. And I really just want to empower people with the understanding of what's actually happening and the true healing potential that our body has once we get out of the way. Once we start fighting against ourselves over and over again, which is what the sick healthcare system is doing, because what are they paid off of? They're not paid off of a successful outcome for you as a patient.
Mm.
They're paid off of the tests that are done, the medications that are prescribed, and the procedures that are done.
Wow.
They're not paid off of how well you do in those things.
Mm-hmm.
So the providers, there's some great providers out there that are stuck in the system that well, I should do that X-ray because I got to keep the lights on,
Yeah.
and it's not fair to providers. It's not fair to the people that are consumers to the healthcare system,
Mhm.
and it's honestly, and I don't say this lightly, we're on the verge of a healthcare collapse.
Mm.
Diabetes is rapidly increasing. Cardiovascular disease is rapidly increasing. All these things are increasing, and we don't have the tools to take care of it because we've gotten so far away from what is really creating the pain experience and what's going to create the solutions.